Yeah.
Thank you very much. Thank you to the organizers for the opportunity to come and moderate this session. It's a pleasure to talk about the one thing that we only remember when we don't have, which is health. And I would like to call to the stage to share this session with me, Miguel Barbosa from Tec2Med and Pedro Pestana from Neroes.
Hello, everyone. Thank you, Inês, and thank you for the invitation to be here talking with you all.
Yes, also thank you for the invitation from the organizing committee and for the opportunity to be here discussing this very important topic with Pedro, who is a colleague of mine, and also with Dr. Inês.
As we were just preparing for the session, we actually realized that we have more in common than we previously imagined. So we all have a keen interest in neuroscience. So I'm a neuroscientist. I know that both Miguel and Pedro also have interests in this area. And I think Pedro has made a business out of neuroscience. So we will talk a little bit more about that.
Yeah.
So I would like to start by asking you to describe the companies that you have, and how long ago did you start?
Okay, Pedro. Okay. So Tec2Med was born in 2019. Basically, Tec2Med is a non-profit organization that's dedicated to bridge the gap between biomedical engineers, scientists, and doctors. Our aim basically is to create environments in the healthcare sector where we can have people from each background giving contributions to the development of new solutions. What happens nowadays, in most cases, is that you don't often have a deep connection between the engineers and the scientists and also the clinicians. And that is actually in many ways a problem, because to develop solutions that really can cause the biggest impact possible, you need to bridge knowledge from people from all backgrounds to develop those solutions. Also, what we do in Tec2Med is trying to bridge this gap, not only by developing solutions or in other ways to try to develop R&D projects that can be developed together between engineers and doctors, but also to develop events, courses, workshops, where we bring everyone together to discuss the current problems, how we can solve them, and how we can bridge new partnerships to solve those problems.
Yeah. So in relationship to Neroes, so basically Neroes uses neurotech and artificial intelligence to work with corporates and reduce 41% of stress and anxiety in just 4 hours of training. So we basically help companies and their employees to really have maximum efficiency in terms of performance, because we increase their concentration, their decision-making velocity, while we reduce a lot their stress. So mental health is also a big issue in this health sector, right? So we really work with that. How we do that? In a really fast way. So basically we use a device that reads electrical brain activity. It's called an EEG, and it's plug and play, really simple to use. And we have a mental training platform where people need to learn how to control a spaceship just with their minds. Okay, every time they are moving the spaceship, they are activating a particular region of the brain responsible for the emotional control. So they are developing their brains directly in that region. And yes, in this way we can monitor their levels and then train them to have really good results.
So how can you measure your results? Because you will be asked to provide performance indicators. How do you sell your product?
Yes, Inês, that was a big challenge. Okay, so basically we use validated scales by psychology to measure in a subjective way. Okay, like back anxiety inventory, that is a scale that is used in psychology. and we do pre-assessments and also post-assessments. But we are also measuring objectively in the brain using biomarkers. And also our algorithms right now can predict the result that you would have in the back anxiety inventory, for example, just by reading the brain in 5 minutes. So in this way, in each training that we have, we can measure the progression of this reduction of anxiety and also in other indicators like decision. We use Tower of London, a subjective also scale from psychology to measure decision making and planning. We use D2 for concentration. It's kind of a game that you need to answer. And we do a pre-evaluation, and then after 3 months we measure it again. And for example, we can measure on average more than 20% of increase in decision making velocity. So it's really mental health, but also in terms of performance.
Very well. And in your case, Miguel, I would like to ask, so how is it to put people with different backgrounds actually contributing towards a common goal? Is this something easy to achieve, or is this something that is very challenging? Please tell us your experience on promoting self-organization with different people.
Yeah, so basically it's not always easy because many times, not really just because of the different backgrounds in terms of, for example, a doctor has a different way of perceiving things in the hospital than an engineer. It's not just those differences in knowledge, but sometimes it's also the difference in mentality. Because the way a doctor approaches a patient to try to treat the patient is a different approach of a biomedical engineering guy trying to create a new solution and solve the problem. Sometimes it's difficult to create a bridge between these different ways of perceiving healthcare and perceiving how we can help people. But nonetheless, it's a very good thing and interesting and thrilling thing to do, because when people really find how they can improve each other's work and create new solutions together, it's a really fascinating thing to observe in reality when we are developing projects.
Can you give us an example of, for instance, a collaboration or a project that has arisen from this this kind of initiative?
For example, one of the many of the projects that we have developing, just to give that explanation too, was born with a congress that we developed. That's the Tec2Med Summit. And many of the projects that appeared come from the discussions that happened in that congress. One, for example, of the projects that we are currently developing, it's with one of the major hospitals in South America in oncology. And basically, they have lots of data there of imaging from the patients that they need to analyze. And so what we're trying to do with the projects with them right now is to use our biomedical engineers here in Portugal and develop the projects with them right there. The projects basically at this moment that they have are much related with imaging analysis, and so with the application of artificial intelligence in imaging analysis. And so, yeah, that's what we have. One example of one of the projects. Also, I can just can give another one. For example, one of the contacts that we have appeared with one astronaut in the United States that basically is currently a consultant for SpaceX, and also he has worked in several space shuttle missions around the years. And basically one of the projects that we are trying to develop with him is relating to printing technologies. So to develop new devices for astronauts, using 3D printing technology. Yeah.
Okay. So in my experience, there's two ways that you actually can go around research. So it can be curiosity-driven. You have your own question and you pursue it, or it can be paid by the taxpayer funds, and then you have to answer societal challenges. And this is so important because we face so many. And actually, neuroscience connects very well with some of the societal challenges that we face today. So here, I would like to ask you, besides your current offer, what are you developing? What's your next move? Will you continue with neuroscience, or will you tackle different questions in neuroscience? So tell us a little bit about the future.
Yeah, thank you, Inês, for the question. So basically, we look at ourselves as a mental health platform, okay? And what we do really differently is that we are really efficient in developing the brain, in transforming the brain in the most efficient way that we can do. So right now we are triggering mental health, emotional control, but it's a region of the brain, right? So if you change that technology to use in a different region of the brain, we can have different results. So in our future, we'll be more focused on mental abilities, not just health, but also in decision making specifically, even being better at getting more decision making velocity and concentration in a lot of different things. But we also think that prevention is really essential. So our business model and the way we do this is really by measuring people and understanding if they are well or if they have something. Because I think in the Occident we have this culture of just when we have a problem, and you started this talk by saying that just when we have a problem we remind ourselves that we have a problem. Oh, right now I'm depressed, or right now I have something really bad like a cancer or something like that, right? And in that moment, health was not important at all. We didn't care about it. But in the moment we have a cancer, it is the most important thing that exists. So in the West, we have a bit this kind of culture, and I think it is important to go a bit more into the culture of the East, or merging both, and really act also on prevention. If we know that we can do really simple things, take care about our food, about our nutrition, about our physical exercise, about our mental health, in 5-10 minutes a day, I think it's much more efficient, and we can prevent a lot of the problems that then we can go there. So Neroes is also really proactive into measuring in the companies just in 5 minutes, not just anxiety, but also depression indicators and other indicators that we can say to people in a monthly basis in 5 minutes. Okay, maybe right now you should start paying attention to that because you are going into that direction.
Mm-hmm. Thank you so much for mentioning prevention, because the brain is like a muscle. If you don't use it, you lose it. And that's the principle of neuroplasticity. So if you don't train your muscles, you will lose muscle mass. And if you don't train your brain, you will lose mental abilities. And we only notice when we don't have them anymore, or when they are impaired. So I think it's great that you're working on prevention to make sure that we pay enough attention to actually exercise our brain, like we go for a walk, or like we go for a run, or like we play sports, because that's really important to do. And we are sometimes so busy that we forget to do that. So we should really pay more attention to our brains and exercise more. And there are many ways that you can do that. And not just with exercise, but physical exercise. This is evidence-based research, is actually still one of the best ways to exercise your brain and to promote your health. So we are all looking in medicine for the magical pill that will keep you healthy and thin and looking great until you're 80, but actually physical exercise proves to bring the most benefit. So this concept of exercising the brain is no doubt something that I would put my money on, definitely. Okay, I think we're running out of time, and I would like to thank our speakers for this session. I would like to thank the audience for sticking with us to the very last moment. And thank you for a great event. Thank you again for coming. And I think our host has some words to say now. Thanks.
Thank you so much. Thank you.